We're with Dr. Dennis Myers talking about our dentistry needs today. And Dr. Myers, a lot has changed so that semi-annual checkup looks a lot different than it did just not too long ago.
Yeah, it really does. And we find that a lot of our patients that come in are really truly not aware of what's happening in their mouth. So we use all kinds of new technologies to be able to show them what they have and the conditions that they have. Like this is a case where we can click on an individual tooth and show them their tooth and perhaps maybe a crack that's in their tooth or an old filling like this. So we can show them and they can see really what we see, even better than we can see it with the naked eye.
And there's a lot of impetus on keeping the original equipment these days, it seems like.
Absolutely. More and more, we're living longer and we're all keeping our teeth. Vast majority, but I think it was in 1960, the average person in the United States had 6 teeth. And
wow.
in 2000, the average person had 22 teeth. Well, that's we're pretty successful, we feel like, in the last several generations.
Now, what kinds of steps go in between making a diagnosis or seeing the patient's condition and then effecting a remedy? What kind of process do you go through?
Well, the first thing is to show the patient what the issues are. But in today's world, it's dealing with their insurance, and we feel like we're really exceptional with that. And you're going to meet some of the people that are exceptional at helping them along the way so that we can reach treatment goals for the patient.
Has the insurance industry kind of kept up? Because with new techniques, they understand the new technologies when you have to communicate that to them?
In some ways they have, and in some ways we're frustrated by that. But nevertheless, we try to tell our patients, you know, celebrate that you have dental insurance. The dental insurance is a relatively new advent. And it's just like find and found money to try to help people. The other thing is that for those people that it's not available for, we have our own dental plan that we can help them with too.
Sure. Now you have technology here, the big screen, the computer interface, but you also carry around a tablet to do the same kind of thing?
Well, anything. This happens to be an email that I received about a patient from one of the specialists that we refer to. And they can point out things, send back reports instantly over the internet, and then we can go over that with our patient or helpfully even forward that on to insurance companies at some time. So the technologies are moving along in dentistry as well.
In terms of email and electronic notifications and so forth, but technology hasn't stood still in other areas too. I know the old-fashioned x-ray of your teeth is quite a bit different. Tell us how that's changed today.
All of the x-rays are now digital, and so that we can look at an x-ray very large and be able to show that to the patient. We'll look at it, we can see it better, we can change the color of it, we can change the contrast, and it uses very little radiation. The whole survey of x-rays that you see there might take less radiation than 1 or 2 of the old type of x-rays.
And by being able to get a large picture, you can start seeing in some greater and greater detail, even a little minor thing starting to happen.
It does, and we even use laser for caries, for decay detection. That helps us to find decay in areas that we couldn't otherwise even see, and catch it when it's very, very small, or even sometimes do preventive sealants in places where sometimes we would have had to wait till it became visible for us to see it, because even lots of decay doesn't even show up on x-ray.
Well, Dr. Myers, why don't we take a little time and visit with some of the other specialists you have in your clinic here?
Good. I hope you do, and I know you'll enjoy it.
We're speaking with a couple of Dr. Myers dental hygienists, and ladies, there's a lot of focus on disease. And tell us a little bit about what's the disease all about, and how do we deal with diseases of the mouth?
Periodontal disease is a bacterial disease that affects not only your mouth, but it affects your overall health. It attacks the supporting structures of the teeth, and we do have some non-surgical means to treat the disease.
Okay, and what would those means of treating amount to?
Well, whenever possible, we try to treat gum disease with the least invasive methods that we can, and that would be non-surgical. And by that, we do a procedure called scaling and root planing, and that is followed by an antimicrobial powder or gel that we place in the pockets, and that is bioabsorbable. It's something that does not have to be removed. It's highly effective in treating gum disease, and it helps with the infection.
And we're talking about a long-term process here, taking care of people's teeth. Dr. Myers talks about we're trying to preserve the original equipment for most people as well.
Correct.
Yes.
And how do you recommend people take care of their teeth on an ongoing basis when they're not visiting the dentist?
Brushing and flossing, and just making sure that they're watching what they eat and how they take care of their teeth at home.
Now, you made a comment too that periodontal disease extends far beyond just the dentistry too. It affects other parts of people's health. How's that?
The bacteria that affects the gums and the supporting structures can also affect your overall health, as far as like your heart and other chronic diseases.
So it's a bacteria type of a situation we're dealing with in that
Yes.
disease.
So
Yes.
if we can control the bacteria, then you can control the periodontal disease, and that's our main focus.
Very good. Is there any long-term procedure or care for a person that's gone through dealing with periodontal disease?
Yes, once you've been diagnosed with periodontal disease, the maintenance changes, and the frequency of how often you need to have your teeth cleaned professionally increases. We see a lot of patients every 3 or 4 months instead of twice a year. So yeah, the periodontal maintenance is a little bit different from just the regular cleaning, but gum disease is something that we can't cure. We can just arrest and manage, so we need to manage it more frequently.
We're speaking with Mindy and Angela, a couple of Dr. Myers' assistants, and Mindy, implants sometimes have a negative connotation to people, but you have
I
a
do.
personal experience you can share.
I do. I've been with Doctor for a long time, and we've done implants for a long, 20-some years. And everybody, when you say the word implant, people are really intimidated by that, and they think pain as far as putting something down in the bone. But my personal experience was my husband just had an implant here a couple of weeks ago.
Mm-hmm.
And it was immediate load, where we just put the implant in, took the impression for the crown, and boom, he had his crown on in a couple of weeks. So, but the experience that I had with him was Dick had no pain, absolutely no pain. He did not have to take medications, for swelling or pain or anything. He felt a little bit of pressure on either side of the teeth, and that was it. He said that was about the easiest thing he's ever had done dentally, actually. So.
And this is a good alternative to help keep all of our teeth.
Oh yes.
It's a nice alternative to something removable, where you don't have to take it in and out every night. It's a fixed, an implant is fixed. It's there. You can floss around it. It's like a normal tooth.
Mm-hmm.
And not likely to get damaged like something that is removable.
Right.
Exactly.
Have a lot
Drop
of
it in the sink, and and it's nice to have something fixed.
It is. It's very
And so it's not the big scary thing that we
No.
No. And
knew
No.
of decades past.
No.
And prep time is not much more than a regular crown, or coming in for a couple of fillings. I mean, it's not like
I think
here
we
all
were done
day.
in 20 minutes.
Yeah.
With the immediate load. Yeah. So, and you have the nitrous, and it's very relaxing, and he was really impressed.
We're talking with Shirley now about new patients. So if I came in as a new patient, what can I expect?
Well, what you can expect with a new patient is we do a very thorough initial exam when you are scheduled for a new patient exam. I would take several different types of x-rays, a panel x-ray, intraoral full mouth series of x-rays, and then I would start gathering information, look in your mouth, write down which teeth you have, missing teeth, crowns, fillings, that kind of thing. And basically I'm gathering information for Dr. Myers to review during the exam process. And then when he comes in, he reviews all the information I've gathered, the x-rays, and we also do an oral cancer screening, check the periodontal condition or the bone level around your teeth, then make recommendations for any treatment he thinks you would need. We have a very comprehensive initial patient exam, and it's very thorough. Once we've gathered all this information, it gives us the ability to sit down with a patient and go through what they need, the financials, and any questions they have, we'll be able to answer them and make recommendations for them to have a healthy, happy smile.
So it may take just a little bit longer in that initial visit than a normal checkup visit, but
Right.
it's important to get all this information together.
Right, especially initially. That way we could become aware of what the patient's expectations are, what their needs, what they're interested in having, whether any cosmetic dentistry or if they're hurting someplace. We can address that all in one initial appointment. And then, you know, plan out treatment for them so that they're comfortable with what they're doing and we're comfortable also with how we're treating them.
And you're interested in preparing a long-term care situation for
Yes, immediate and long-term. We want to immediately get anything that's hurting them taken care of, but we also want to address their oral health throughout their lifetime. So we look at the long-term and provide solutions or alternative treatments in various different ways to where they can take a pick of what kind of treatment they want.
Hi, Joyce.
Hi.
I'm Steve.
Nice to meet you.
Tell me a little bit about the insurance and paperwork that we can get started out here.
Sure. When you call our office, one of the first things I'm going to ask you is, do you have insurance? And if you do, then I want to know who's the policy holder and a little bit of specific information, because then it's my job to call your insurance company and find out what's covered, so that you know when you come in the door, hey, do I owe anything? What's my expected copay?
Sure.
Once you're here, and we do that for each additional treatment sequence that you would have, so that we really try hard to let the patient know what they owe financially.
What if I don't have an insurance carrier per se, especially for dental? You got an arrangement we can make?
We certainly do. We have two options. We have our in-house dental plan. We offer two different plans. Those are available on our website. If you want to get information, you can call. I can mail you some information. But those are effective immediately, which is nice. A lot of dental plans, if you take out a new plan, you have a 12-month waiting period on crowns.
Wow.
With our dental plan, you have no waiting period.
So it kind of eliminates the fear. I can come in, make my appointment, and get started right away.
You betcha. You betcha. There's no waiting periods at all. As soon as you're available right then, if our gals have time, we can just take you back and do the treatment that same day.
Now, Joyce, tell me a little bit about Care Credit, something you guys offer?
Yes, that is a specialty credit card. You can't use it to buy groceries at Walmart, but it's for specialty medical or dental services. And one of the great things about Care Credit is they have promotions where you can have 6 months or 12 months interest-free. So that's how a lot of our patients pay for their dental needs that don't have the money for the copays. So we can set you up with that too. And that is also on our website under finance options. You can look for the Care Credit logo.
Dr. Myers, what about ongoing care? What kind of message can we send to patients for routine maintaining their teeth?
Well, I hope they got the feeling in meeting some of the other staff members that we really do care about the ongoing relationship. It's not just about fixing, because what it's about is long-term prevention. And the hygienists are here 5 days a week. They take early morning appointments. We have lunch hour appointments. So we're here for the long haul. We're here to be with the patient.
We've been sharing with Dr. Dennis Myers, and now we've got some information up on the screen. You can follow up and prepare for your appointment.